All right, hi everyone. Thank you for joining us for today's webinar, Human Trafficking, Prevention and Intervention. For your information, all participants' microphones are muted today. If you have any questions, we ask that you please use the Q&A box that is located in the bottom center of your Zoom Windows taskbar. The chat box is also available if you have any comments or technical support questions during the presentation. As a reminder, the webinar is being recorded. The recording will be available on the Saskatchewan Prevention Institute website and will be emailed to you in the coming days. My name is Jasmine Ogren. I'm the Sexual and Reproductive Health Program Coordinator with the Saskatchewan Prevention Institute. The Saskatchewan Prevention Institute is a provincial nonprofit organization located on Treaty Lands 2, 4, 5, 6, 8, and 10, and the traditional lands of the Métis people. We acknowledge that our work is carried out on and with the people from these lands. We are committed to working towards reconciliation and strive to reaffirm our relationships with one another. Our organizational focus is to help all children thrive through primary prevention and the promotion of well-being. We believe that all children, regardless of ability, have the right to the best physical, social, and emotional health possible. We provide education, training, and capacity building across 6 main program pillars: early childhood mental health, perinatal and infant health, prevention of child abuse and neglect, prevention of child injury, prevention of fetal alcohol spectrum disorder, and sexual and reproductive health. One focus of the Sexual and Reproductive Health Program is to provide evidence-based information on topics related to violence and exploitation prevention. Increasing our knowledge and understanding about human trafficking is a necessary step to prevent exploitation in our communities. Here to speak on this topic today is Kalish. Carly is the recipient of the Toronto Police Service's Leading the Path Award, Toronto Foundation's Vital People Grant, and Attorney General's Victim Services Award for her dedication to working with survivors of gender-based violence. Carly holds a Master of Social Work from the City University of New York. She has attended the Nonprofit Management program at Harvard University. Thank you for being with us today, Carly. You can start whenever you're ready.
Thank you for having me. I'm so excited to be here. I'm so excited to hear all your questions later and learn from all of you. So I'm gonna jump in because I've got an hour and so much to share. And so here goes. And let me know if you can't see my PowerPoint, but I'm gonna start sharing now.
We can see it.
Good? Okay. So before I start, I think it's just important that we address that this, the trigger warning of what I'm going to be talking about. And so please take care of yourself. Do what you need to do to take care of yourself. If you feel comfortable, great. If you feel a little bit uncomfortable, but still at a place where you feel like you're learning and you can stomach the information, good, keep going. But if you feel incredibly uncomfortable or incredibly triggered, please check in with someone, a safe person, and take the space that you need. So today we'll be talking about myths and misconceptions of human trafficking, sex trafficking specifically, the stages of commercial sexual exploitation, red flags and vulnerability factors, how human trafficking actually meets vulnerable people's needs, and then interventions that you all can take a stab at starting wherever you are, and also some awesome resources that you can utilize if you are supporting or interacting with anyone who's involved in domestic sex trafficking. So we'll talk about domestic sex. We'll break that down. But I think it's really important to understand what we're talking about. So human trafficking, like the cheating definition, is force, fraud, and coercion facilitated by a third person. So someone is doing something to you, they're forcing you, they're tricking you, they're coercing you for the purposes of exploiting you. And in this instance, we're talking specifically about the sex trade. So they're exploiting you through the sex trade. And a third party, a person or a group of people, needs to be doing this to you. You cannot traffic yourself. And so that's if you can remember, force, fraud, and coercion facilitated by a third party, that's really what human trafficking is. And of course, there are multiple forms of human trafficking, but today we're focusing on sex trafficking. So I wanted to go through some true or false questions, sort of to debunk
Marley,
some myths and misconceptions. Yeah,
sorry to jump in. We can only see the first slide and it's not on the full screen. Oh, it's not on the full screen mode.
let's try that again. Let's try it again. Now, are you seeing it?
Oh, maybe. No, it's not. It's not popping up.
So weird. Okay, Jasmine, can I ask you to share the slides while I present? Is that possible?
Sure, I'll give it a try. Just give me 1 second here.
Okay, sorry, everybody. So I'm seeing my full slides and they're turning. So this is so weird. Let me try one more time. Slideshow from beginning. Are you seeing my agenda now or no?
No, we're not. I'll pull them up here and we can
No.
try it that way.
So sorry. There's always a tech issue. For those that are signing on, we're having a tech issue with sharing the slides, so we're just trying to work through it. We'll hopefully have it up and running in a second. That works on my end. Does that work on, is that working for everybody else? Yes. Okay. I'm seeing a yes. Okay. There we go. Thank you for problem solving, Jasmine. I'll keep
Perfect.
going.
Sorry
So
about that.
this is what I was talking about. Thank you. Thank you. Okay. If you wouldn't mind going to the next one. Okay. So very quickly, before we get into our true and false questions about the myths and misconceptions of human trafficking, just to talk about the prevalence of how common this is in Canada, and specifically in Saskatchewan. So we know that most survivors of human trafficking do not understand that they're being trafficked. And this is the major reason they're not coming forward to law enforcement. Also, we know that traffickers are experts at convincing someone that what in fact they're doing is a crime and therefore they should not report it to law enforcement. And then, of course, there's the whole concept of shame and stigma. And because of that, you're also not reporting to law enforcement. And so we know that there's an estimated 16,000 people currently being trafficked in Canada, but we know that that's just the tip of the iceberg. And specifically, there was a compilation of data between 2009 and 2019, so 10 years in Saskatchewan, where there were 36 incidents of human trafficking that were reported, and 17 of those were in Saskatoon, including 9 reported alone in 2019. So we know this is increasing, and we also know, again, that the likelihood of human trafficking happening is much more than 36 incidents in your whole province combined. We know that. But this is what is being reported to police. We also know from Canadian Centre to End Human Trafficking, they've just done this incredible study of where all the calls they're getting from Canada exists. So 2% of all the calls in Canada are originating from Saskatchewan. And that we also know that although Saskatchewan is not a hub for human trafficking, it's on the route to a hub, and likely human trafficking is existing on the way, right? And so there's this Western Circuit, which connects Calgary, Edmonton, Fort McMurray, and the Brant Prairie from Quebec. So these are Quebec residents. They most likely speak French. They're bringing them to English speaking places, and they're likely stopping in Saskatchewan along the way. In general, in Canada, so we know that 65% of those trafficked are under the age of 25 years old. 93% are female, and we know that LGBTQ and youth are, in general, are at higher risk of being trafficked. So, how, I guess I can't even ask you questions, or I guess you could put in the chat. Put your hand up, because there's a hand up hand, or like in the bar, or put in a yes in the chat. How many people have seen the movie Taken? That Liam Neeson thriller where, okay, yeah, I'm getting a million yes, 12 hands up, yeah. So most people have seen it, right? And so what that depicts human trafficking to be is really not what it's like at all. So for those of you that haven't seen the movie or need a recap, it's basically, this young person travels abroad after graduating with her friend, and she meets this charming guy at the airport, and he offers to give them a ride home, and he seems really lovely. And then later breaks into this apartment that they're staying and forcibly takes her from this apartment and brings her into the sex trade, where she has a needle in her arm, she's drugged, and she's sold in like a live auction style. And so everything about what is depicted in that movie is just not accurate in terms of the Canadian understanding of what domestic sex trafficking actually is. And so it's really important to know that traffickers are not often strangers. Trafficking is a relational crime and requires a relational response. And so even if the person didn't know you before, they're going to work really hard to get to know you before you are going to be trafficked. There is a ton of grooming involved in human trafficking, like sexual abuse. And so it is not often a stranger who is trafficking you. 85% of the clients we support identify their trafficker to be their boyfriend. And for the 15% where it's not their boyfriend, it is a friend or actual family member. So parent, foster parent, step parent, uncle, for example. And so it's really important to know it is not the stranger who's kidnapping you or smuggling you or throwing you in a van. It is a relational crime. It requires getting to know the person on an intimate level to understand what needs are not being met in their life and how that person can fulfill them. Next slide, please. So you're hearing me say the word domestic sex trafficking. And so the majority of the trafficking that exists in Canada, one stat says over 70% of the human trafficking that exists in Canada is domestic. And then another stat says 90% of the human trafficking, the sex trafficking that exists in Canada is domestic. So we know it's somewhere between 70 and 90%. Either way, we know it's by far the majority of the trafficking that exists. And what this means is that, when you go to the airport, if you fly internationally, you start in Canada and then you take a plane and you end up in another country. And domestically, if you fly domestically, you start off in one country, you fly within that country, same as the definition for human trafficking. So we're talking about people who are in Canada already, who are being trafficked within Canada. No movement actually needs to take place at all. You can be from Saskatoon and be trafficked in Saskatoon. You can be from Toronto and be trafficked in Toronto. No movement is necessary in order for human trafficking to exist. Remember, it's force, fraud, and coercion facilitated by a third party. They're exploiting you for the purposes of introducing you to the sex industry and benefiting from your exploitation. So it's really important to know, yes, international sex trafficking does exist, but in Canada, it is existing much less frequently than people who are either Canadian born or the reason they came to Canada had nothing to do with their human trafficking. They're now here and they're being trafficked here. That is what we see every day in terms of human trafficking in a Canadian context. Next one, please. So we often think of traffickers as like these much older, creepy men, right? Like that's like often our depiction of what, you know, if you Googled it, what you think you get. But traffickers, because 85% of trafficking situations mimic intimate partner relationship, traffickers are often the same age or a few years older than the person they're trafficking. It's not always this much older guy with this much younger girl. I mean, that can happen. But again, what we're seeing much more frequently is people who look from the outside world as if they're the same age or in a relationship. So they're a few years apart. Does that make sense? I just kind of comment that the slides are not changing. Is that happening again? If you could just let us know in the chat. They're changing. Okay, good, good. So we'll just keep going. I'm sorry for the person who's having that problem. Hopefully it gets resolved. The other thing I think we need to know is there's lots of true or false. So if it's stuck on true or false, it's because there's lots of them. So they might be different true or falses for those who wrote that comment. So boys and men are trafficked, but they are not trafficked at the same rate as women. And they're also, you know, it's also likely that we don't know how many boys and men are being trafficked because, again, of all those reasons I discussed in terms of women and young girls not feeling comfortable disclosing, in terms of the stigma of being a boy or a young man reporting to police and identifying as a victim or survivor of human trafficking, those numbers in terms of stigma would increase significantly. And so we do have clients, we do see boys and young men who are being trafficked, but not close to the rates that we see women. And it's probably a combination in terms of, yes, the numbers are lower, but also in terms of it being harder to seek services and supports, and of course, the stigma. Next one, please. So we all also often think that human trafficking is always this incredibly violent crime. And this is going to sound trigger warning. And a lot of what I'm going to say is trigger warning. So apologies in advance. You're selling a product, right? That's how traffickers are thinking of the people they're trafficking. And so the more damaged a product, the less valuable it is. And so, yes, physical violence is sometimes used and in lots of cases is severe. But in lots of cases, it isn't there at all, or it is used as a mechanism to show what the trafficker, the pimp, you can use those words interchangeably, is capable of, but they're not using it in a way where they are going to physically damage their product. And I know that sounds so like such a crazy thing for me to say. And so, yes, it's important to recognize it, but this is not the only sign when we're talking about human trafficking. It is used as a mechanism of control, and it's used as a mechanism of fear, more so than it is constant. And the same sort of goes with drugs and alcohol. You know, we have these preconceived notions that all survivors of human trafficking are drugged or are drug addicts or are drug users. And again, it's used as a mechanism of control and power, right? So if your trafficker knows that you use drugs before you are being trafficked, they will be the ones who offer you drugs. They will be the ones who control how you get those drugs, how much drugs you're getting, what drugs you're getting. It's a mechanism of control and power over you. Sometimes they do introduce the idea of drug use, and sometimes you feel pressured and you have, you know, no power to say no. And sometimes you feel like you need those drugs in order to numb the pain of the exploitation. And so again, it's not always, it's not like a, well, there's no drug use here, so this mustn't be human trafficking. It's one of those things that is sometimes involved and sometimes not. In the movie Taken and in lots of depictions of human trafficking, you're seeing young girls in a cage or chained or in handcuffs, physically confined. And again, this can happen, but I could probably count on one hand the times that I've heard survivors say that they were actually physically confined. But human trafficking makes you feel like there is a fence around your brain. You are so scared. You are terrified to leave. You are embarrassed. You are shamed. You know, the trafficker, once they have one picture of an ad that they posted of you, they have everything they need against you. And so it feels like you can't leave. Like, so often I get the question from people that are like, well, why didn't they just go down to the hotel lobby and tell someone they were being trafficked? Because it's so much more complicated than that. They feel like, who is ever going to love me again after this? Where am I going to sleep? Where am I going to get my next meal? What if someone finds out, right? And so it's this Stockholm-like feeling of being trapped, of feeling shamed, of feeling scared, right? Like if they use the violence to show you, if you leave, I will do this to you. If you leave, I will tell your family. If you leave, I will kill you. It's that keeps you there, and the love that you feel for this person that keeps you there much more than you are physically confined. And we'll talk about that love as we keep going. I think it's also really important to understand the difference between sex work and sex trafficking. So I like to think of it as a spectrum. There is a million reasons why people enter the sex trade. And there's also a million ways you can be involved in the sex trade. You could be doing cam work, you could be doing stripping, you could be doing in-calls, you could be doing out, like it's endless, all of the ways. You could be doing porn, right? Like all of these things are in the sex industry, but they're not all the same. And all the reasons why people enter the sex industry are also not all the same. And so I think of them as the spectrum, and I call them the 3 C's. Choice on one end of the spectrum, circumstance in the middle, and coercion on the other opposite end. And so, okay, here I'm in the first C, I'm a choice. I'm a consenting sex worker. I am choosing what hours I work. I am choosing what services I perform. I am choosing how much I charge for those services. I'm choosing the clients. I'm screening the clients. And all of the sex I am engaging in for an exchange is consensual sex, right? The opposite end of the spectrum is I'm being forced. I'm being tricked. I'm being manipulated. I couldn't leave if I wanted to. Someone is benefiting from me being here that's not me. Every time I, in fact, have sex with a client, it is not consensual. Now, the middle is where it's really gray and really murky, and people really struggle with understanding this, which is when people's situations are inherently exploitive and inherently dangerous, but no person is exploiting them. So, for example, poverty exploits people. Sometimes people's mental health status exploits people. Sometimes addiction, drug use can exploit people. So there's no person, there's no third party exploiting you, but your situation is inherently exploitive. Does that make sense? So choice, circumstance, and coercion. You can't traffic yourself. So if you are being trafficked, you're being coerced. And it doesn't mean that if you are doing circumstantial sex work, or if your circumstances have led you into the sex industry, it's often that you can move from one C to another. So of course, the people who are doing circumstantial sex work are more susceptible to being trafficked. And it's also often the case of a lot of our clients, I say, well, I'm used to this form of trauma. I'm no longer trafficked, but I'm going to engage in sex work because what am I going to do? Work at McDonald's? No, I'm going to make I'm going to do this until I make $10,000, and so I can pay off my debt, or until I can, get a down payment for that apartment I wanted to lease. And so it becomes really difficult when you categorize everyone as in the sex trade as being exploited. Some people may be exploited, but they might not be being trafficked. So it's really important to differentiate between the two. And so what does it actually look like to be trafficked? So these are the stages of commercial sexual exploitation. So first, you are lured, and it doesn't look like, okay, someone is coming after me again in a white van and throwing me in. It feels like someone, I hope it's okay if I swear, Jasmine, someone like, holy shit, someone feels like they finally want to get to really know me. They're asking me all about my life. They're asking me what my hopes and my dreams are for the future, what my goals are, what I'm really hoping is different. I'm really struggling with my parents, like the details of the intimate details of their life. It feels like someone is listening to you in a way that you have dreamed of someone listening to you. And then they're going to, find out what needs are not being met in your life, right? So is it that you're not getting along with your family? Is it that you feel like you need to move out? Is it that you're already living in a youth shelter? Is it that, you feel inadequately loved or supported? Is it that you had previous abuse? What is it? Or you don't have enough money for the things that you need or want, right? So they're going to make you feel incredibly loved and incredibly special, whether that's through an intimate partner relationship, which again, most of these human domestic sex trafficking cases are, or if that's through a friendship, or if that's through a parental figure. They're going to take you out. They're going to spend money on you. They're going to make you feel incredibly cared for. And then the coercion and manipulation happens. And so they're incredibly loving and amazing to you, and then they pull away. And then they're incredibly loving and amazing to you, and then they pull away. And you're like, what did I do wrong? I'll do anything to get back into your good books again. And so, because they're also meeting your needs, right? And so you might do things boundary-wise that you wouldn't have done before. And that might be sexual, or it might not be sexual. It might be like, holding drugs, holding money, being on the lookout for a different crime that's being committed. It might be, that video, my friend thinks you're so attractive, they really want to see that video you made for me. And you might say, no, of course you can't share that. And then, these mixed messages happens, and you might say, okay, fine, right? Like you feel like you'll do things that you're being pushed to a limit that you would not feel comfortable with, but that you do because of this manipulation. And then they're incredibly loving and amazing and pull away, right? And then they mess with your sense of self. They break down your spirit, and they introduce the idea of being involved in the sex trade. And this could look really direct, or it could look really insidious. And at this point, they're also isolating you and confining you. Again, not physically, but from a place of they are the only person that's taking incredibly good care of you, so you don't need anyone else. Some young people even share social media passwords. And so we often hear of traffickers going in and deleting worried messages of friends and family who are saying like, I haven't seen you in a while. Are you okay? Where have you been? And then they'll also do things where they'll say, oh my God, that friend is such a bitch to you. Why do you have anything to do with her. She said this to this about, right? And so they're manipulating you to believe your support systems no longer care about you, in that this person is the only person who really cares for you and will really be there and help you meet your needs. And then they introduce the idea. And again, this can be insidious or it can be direct. So they might say things to you like, well, you know, all those things I bought for you, you know, those gifts I gave you, you know, I took you shopping that time, or you got your nails done that time. You thought those things were free? You have to pay me back. I have this idea. No one will have to know. We'll only have to do it until we make this much money. You know, that house we really want to buy together, you know, that family we want to start. I have this crazy idea. You don't have, you know, you can say no. And so they'll introduce it like this. Sometimes you'll catch them looking at Leo's List, which is like the website in which escort ads are posted. And they'll be like, what are you looking at? And you'll be like, look at these girls. You're so much prettier than her. You could be making so much more money than her. Imagine you charge since we've had sex the first time. Imagine how much money you could make. And so they're using threatening tactics, they're using manipulation tactics, and they're using tactics of extortion, in terms of, if you don't do this, I will tell your family. If you don't do this, I will post that nude you sent me online. If you don't do this, I will do this. And so all of these things play out in terms of feeling like you don't have a choice. And so many of the survivors we support said, but Carly, I said yes. And I explained to them the definition of consent. And I said, you know, you can't consent to something under duress. You can't consent to something when you felt like you didn't, you know, it didn't feel like you had a choice because you were being exploited, or you were being tricked, or you were being coerced. That negates your yes. And it's so important to explain this to people and really understand the concept of consent, because that in itself is so reparative in them thinking, oh my God, I thought I chose to do this. I thought I said yes, so this is all my fault. And so that removes some of that from them. And then it's also really important to know, because some services that support human trafficking survivors, they refuse to work with survivors who recruit other girls to be trafficked. It's actually part of the cycle. And 80% of the clients we support at the agency I work identify that they, in fact, recruited or were asked to recruit other people to be trafficked. And often they said yes. And so we're like, how do you possibly bring someone into this after you know the trauma, you know, that you've endured all this trauma? Why would you do that to someone else? But it's in fact survival. If you are given a choice of, you have to bring in less money yourself. Your quota is less. And these people are often given a quota, a certain amount they have to make every single day until they can stop. You are actually protecting yourself from having to do that. And it's also self-preservation, right? And so if you are not choosing where you sleep, who you are engaging in sexual relations with, what services you are providing, how much you charge for those, like literally where you eat, every choice is no longer yours. And if you get a chance to reclaim some of that power, you take it. That's just human nature and survival. And so I think it's really important to recognize that that is not survivors' fault, that they say yes to recruiting people. It's often part of their exploitation. Next slide, please. Jasmine, would you mind putting on this YouTube video? I'll just preface it really quickly. This is of a survivor. Her name is also Carly. Her name is Carly Church. We work really closely together. You might know her because she's quite famous now for sharing her story. Just so you hear how she was brought through, she's going to talk about how she was brought through the cycle of exploitation. So you hear it exemplified through a survivor's voice. Any luck, Jasmine? It's actually embedded right into the PowerPoint. So you should be able to just click that link from the PowerPoint. Nope, that's a different one. If you prefer, Jasmine, we can send it's a YouTube link, so we can send it out to everyone to watch after for the sake of time if you prefer.
I think that might be the better option. I can't seem to get it to work here.
No problem. Always a tech
Oh,
thing. So yeah, so we'll send up that link. I think it's really it's a really powerful video where Carly shares her story, and she walks you through the luring, the grooming, the manipulation, the coercion, exploitation, and her, her whole story. So please get a chance to watch that when you can. Okay. So what are some red flags to look out for? And someone wrote a question in the chat. We're going to answer it. We're going to do our best to answer it later, I promise. You're looking for marked changes, right? So if they have this new partner all of a sudden, the partner might seem abusive, the partner might seem amazing. But what you will definitely see is that the survivor, the victim, becomes very dependent on one person. They become very dependent on spending time with this person, not sharing much information about this person, and making you feel like this person knows them better than anybody else in the world. They're creating distance between the survivor's social support system and this person. That this person's job is to create that distance. And so those are some signs you can look for. Potentially a new group of friends, potentially isolating themselves from their existing group of friends. Often I see sometimes where it says red flags on some lists that are like, you look the stereotypical way you would assume someone looks in the sex trade. What I say much more commonly than that is that there is unexplained things. And so sometimes there's a marked change in the look. Sometimes people look the stereotypical way you think they look, and sometimes they don't. And so that's not just the one thing to look out for, but you're looking for unexplained access to money, unexplained access to things. You're looking for just this marked change in appearance. Hotels, there's a new thing about hotel parties. Not everyone who goes to hotel parties is involved in the sex trade, but having a hotel room keys on a young person, like that's unusual, right? So that's like a physical thing you can look for. Hotel pens, hotel mini soaps and conditioners, things like that. And then of course things, of course, in terms of a marked change in drug use or alcohol use could be a sign of many other things as well. Often traffickers hold on to someone's identification for them. Even this could be like their bus pass, their student card, any form of identification. Traffickers like to hold on to that. And so that's definitely a marked change. I don't know if anyone works in, and again, I'm from Ontario, and so I don't know the language to use, but like Ontario Works or like welfare or ODSP, what we call it is like a disability benefit. If someone is picking up a check on a regular basis, so that's a definite marked flag. of this person might be being trafficked. And then some people identify as being a sex worker, but a consenting sex worker. And of course, that exists, and that's not what we're talking about today. But if they're a young person, you might want to, then ask further questions in terms of, are you keeping your money? Who's posting your ads? Is someone else benefiting from you being there, etc. And then, of course, school, right? They're not around in school. They're skipping school. Their grades are dropping. And they're staying out late at night. They're sleeping excessively during the day. And you can't look at one of these and say, oh, my child is sleeping excessively during the day. They must be being trafficked. Or I found one hotel key in my kid's backpack. They must be being trafficked, right? It's a combination of these things that you want to be looking for. Next one, please. Very quickly, because I think it's important, and this is often something we forget when we're talking about human trafficking. We have the exploitation of being trafficked, so the sexual exploitation, but often traffickers, and this is new as we're learning more about human trafficking, they're also financially exploiting you. Never mind just holding on to your money and not paying you for the work you are doing, even though it's trafficking. They're also opening credit cards in your name. And sometimes survivors know about this, and sometimes they do not at all. And so sometimes it's what we would call fraudulent when you don't know about it at all. And sometimes we would call it coercive debt when you knew about it, but you felt like you had no choice in terms of stopping the coercion from happening. And so often traffickers will actually pay for the credit cards, pay for the escort ads, pay for the Uber Eats and the iTunes and all of those things that are being paid for in order to exploit you, in order for you to exist in that exploitation, but it's actually in your name. And it becomes incredibly difficult to catch survivors when they're doing this, because you can say, well, look, she put it on her credit card. I didn't make her do anything. She paid for this hotel room herself. And it's really just important to note that this is happening. And so when you leave your trafficking situation, not only do you have sexual exploitation to process, but you're literally having creditors call you, which is a reminder of the financial exploitation, but also a reminder of your sexual exploitation that is occurring. And the average human trafficking survivor that we support, it's approximately $20,000 of debt when they leave their trafficking. And so traffickers are using this as another mechanism to make sure the people they're trafficking, their victims, don't leave, and holding this financial debt over their heads, in addition to the fear and the stigma and all of those other pieces we talked about. Next one, please. So what makes somebody vulnerable to being trafficked? And so I like to think of it as this Venn diagram. So individual risk factors and systemic risk factors. So on one side of the circle are individual risk factors. So low self-esteem, lack of self-worth, feeling inadequately loved and supported. Maybe you have a developmental disability. Maybe you have been bullied. Maybe you've experienced previous abuse or neglect. And then, of course, systemic risk factors also play a huge role in who traffickers are targeting. And this, of course, has to do with poverty, low socioeconomic opportunities, of course, racism, colonialization, isolation in terms of communities not having adequate social support networks of the LGBTQ community, and language barriers in terms of newcomers. So I wanted to break those systemic risk factors down a little bit. So next slide, please. And of course, for those who have both individual and systemic risk factors, those people who can check off those lists of both are, of course, at the highest risk of being trafficked. And just some information in terms of being racialized. So racial and ethnic minorities are 2 times as likely to be trafficked than their white counterparts, and they're more likely to enter at a younger age. and they're more likely to be engaged in street-level sex work, and they're more likely to have negative interactions with law enforcement. And so it's really important to recognize these incredible factors that lead to increased vulnerability. Next one, please. Same with newcomers, right? So this is the case. So I know we're talking specifically about domestic trafficking, but just because you're from somewhere else doesn't mean you're not going to be trafficked here, right? So that's domestic trafficking would include newcomers. And of course, language barriers, lack of just acclimatization to a new environment, obviously prejudices and discrimination, feeling isolated, a feeling a loss of cultural and identity, all of those things, obviously high rates of poverty. And so all of these things, again, add to additional vulnerabilities of being targeted by traffickers. Next one, please. And of course, being Indigenous. So we know that although in Canada, Indigenous people make up 4 to 5% of the population, 50% of human trafficking survivors are Indigenous. And this, of course, is because of the legacy of colonization and the residential schools and foster care in terms of the 60 Scoop and the Millennial Scoop, and gaps in service provision and poverty, criminalization of poverty, racism and discriminatory policies and legislation that continues today. Next one, please. And the LGBTQ community also has increased vulnerability to being trafficked. And there was a question specifically about trans statistics, about trans people who are being trans and non-conforming folks being trafficked. So there are no specific stats on this, but as you can imagine, the more vulnerable you are, the more unlikely it is that you're going to report. And so it's incredibly hard to capture these statistics. I wonder if the Canadian Centre to End Human Trafficking is asking this question on their calls, because they come out with reports quarterly about who is calling in terms of accessing support through their hotline. So I'd love to look into this a little bit more and see if they have any of these stats, and I can share them with Jasmine should they do, but I did not come across any statistics specifically about trans and non-conforming, gender non-conforming youth and young people in general. But of course, again, because of the isolation, feeling systemic discrimination in institutions, and also feeling in terms of caregivers and family not supporting you, and feeling that you have to leave where you are, you have to leave your family in order to be safe. That of course is going to increase your vulnerability to being trafficked. Next one, please. So I'm sure everybody's familiar with Maslow's hierarchy of needs. You've all seen this, I'm sure, a million times before, but I think it's really important to apply it to a human trafficking lens, a human trafficking perspective. So it's our caregivers' needs, whoever our caregivers are, to make sure we have, food in our bellies and clothes on our back, and that we are safe and supported and secure, and that we are loved unconditionally, right? And these are our caregivers' jobs. The number one risk factor that we see of the survivors we support is that they had previous relational trauma. So trauma that was endured either because of their caregivers directly, or because of abuse or neglect, or because their caregivers were unable to protect them from abuse or neglect from somebody else. And so the number one risk factor being trafficked is previous relational trauma. Now, traffickers are experts at sussing out vulnerabilities a mile away. They're experts at finding out whose needs are not being met, and their job is to find replacement ways to meet their needs. So if someone feels inadequately loved, they become the person who loves them. If someone feels their family isn't keeping them safe, they become the person who keeps them safe. If someone feels their family can't afford to take care of them, they become the person who takes care of them in terms of their financial needs. If you take anything from my presentation, I hope it's this. It's in fact unfair to ask someone to leave their human trafficking situation unless, as service providers, we have found replacement ways to meet their needs. So often we are so uncomfortable when we hear that someone is trafficked that we want to save and rescue them. Some people want to be saved and rescued, and then that's fine. But for those people that don't, it's incredibly important, and you're actually setting them up to fail if you haven't found replacement ways to meet their needs before they leave their trafficking situation. So let's talk about this in terms of a stages of change model. And again, I'll put the video of the stage of change model we'll put it in the chat, and Jasmine will send it out. So that it explains in 2 minutes what the stages of change model, but I'll explain it faster in terms of making sure we cover all of our content today. So for those of you, I'm sure you all know, again, you all have seen a stages of change model before, but basically you have to assess whether someone is really contemplating making a change, really eager to make a change, at this place where they're like starting to make the change, or if they're like not even thinking about making the change yet, in order to understand how to support someone in the change that they want to make. And so let's apply this to human trafficking. So imagine I said to you, I get, this is something that happens to me all the time. I get a call from a parent, and the parent says, I found my daughter's Leo list ad online and hotel cards in her room. I know definitively she's being trafficked. Carly, you got to talk to her. Oh, and I'm like, okay, bring the daughter in. So I meet the daughter the next day, and the daughter says to you, I don't know what my mom told you, but like, I have this boyfriend and I couldn't be happier. My mom never supported me, never took care of me. She doesn't love me, but he takes really good care of me. So she would be at a stage, and we know she's being trafficked, but she would be at a pre-contemplative stage. Can you imagine? I said to that young person, don't worry, your mom told me everything. You never have to see him again, and we're going to get you out of there. What would she say to me? She'd say, wow, you didn't listen to a thing I said. And of course, everything in my being is, of course, wanting to leave, but it would be like saying to a drug user, just don't worry, you never have to use drugs again, to someone who has no desire to stop using drugs, right? Like, as much as it is my goal for her to leave, as much as it is her mom's goal for her to leave, yet often because of this Stockholmian relationship they have with their traffickers, they love them. And they're terrified at the same time. And so you have to respond in an appropriate way based on where that person is at. And so if someone is pre-contemplative, right, so they're not identifying their trafficking situation to be a problem at all at this point in their lives, you're going to have to bite your tongue, and you're going to have to equip them with every harm reduction strategy you have in your tool belt to make sure whatever it is they're doing as safely as possible. You're also, of course, going to safety plan for that with them, so that if they are at a place where they ever feel unsafe or where they ever feel in danger, they know what to do and how to respond. Because no matter what you're going to say, they will go back. And I'll talk about a resource we have for that at the end. If someone is at a place where they're contemplating, so they're like, yeah, he's really great. He takes really good care of me. And sometimes he makes me do things that I don't want to do, but usually he's really great. You want to understand both the pros and the cons of that situation. So I'll give you a personal example from my life. I have a friend, and she's in a really crappy relationship, and all she does is complain to me about how crappy her relationship is. And, I said to her, Leah, why don't you just leave him? And then she's like, no, Carly, you don't understand. He's really great. And she became really defensive because I only empathized with half of what she said. And so when someone is contemplative, you really have to empathize with both and all of what they're saying. Yeah, a part of you is really scared that you're being made to do things you never in your life thought you would do, but you're terrified that you'll never feel loved like that again if you leave. Wow, that must be so, how hard for you, right? And so you need to be able for them to see that you understand both why it's not a simple decision, but also why it might be incredibly dangerous. If someone is at the preparation stage, so they're ready to make a change, ready to leave, and this is the point where you really have to make sure that you have addressed all of their basic needs. You cannot leave if you don't have a safe place to live. You cannot leave if you don't have money, right? In terms of like, where are you going to get your next meal? Where, you need to have your basic needs met if you are going to leave and you're going to be able to leave safely. So those are our jobs, to surround survivors with a support system, healthy, supportive people, and literally housing, food, all of the things you need in order to be okay, to be alive. And only when those things are in place is it actually safe to leave, right? So what shelter have we found them? What mental health supports have we found them? All of those pieces, have we got them on, on some sort of income benefit so that they can be okay and so that we can sustain them leaving. And if someone has left, the work is not done. You have to process the temptation to return and the strength it took in leaving. And only when someone has all of their basic needs met and they feel currently safe and currently supported can they do any sort of deeper processing therapeutic work. But you can only do that once you know your safety isn't threatened. And know that it is very common to go back, and that we can't judge people for going back or relapsing or lapsing, but that it is an opportunity to learn and grow. And so that's how we support survivors of human trafficking, without judgment or assumption, but really meeting them where they're at and really employing a harm reduction perspective. Next one, please. You mind going to the next? There we go. So I already covered this, so we can skip it. Just really simple things to keep in mind, right? When you're engaging with someone you believe is being trafficked. Listen, use open-ended questions. Don't call someone a victim unless they call themselves a victim. I wouldn't even call someone a survivor unless they, they're choosing the language that you're using to describe them. Don't make assumptions. You want to be sensitive to asking too much too soon. You want to spread talks over several sessions if you can, and not show your shock or your, any of your personal reactions on your face or through, your expressions. And encourage their agency, right? Like, when you're ready, I can help you with this. And safety plans need to be specifically tailored to individuals, not just, a template to fill out, to specifically address their needs in the moment. Next one. And here are some questions that I just like, when you're not really sure what to say, or when, you assume someone's being trafficked, but they haven't made a disclosure. Here are just some questions to keep in mind, and you can refer to these should you need to. Are you being forced to do something you don't want to? Could you leave if you wanted to? Do you have control over who you spend your time with? Has anyone threatened you? Are you doing this because you were promised something in return? Do you get to keep your money? How many hours a day do you work? Who decides where you sleep, eat, what you wear? So just some things to, start that conversation should you suspect someone is involved in this, and you're not sure where to begin. Next one. And I'm sure you know this better than most most groups I present to in terms of being trauma informed, right? You have to always, number one, you have to address their safety, ensuring physical and emotional safety. And of course, you want to give clients as much choice wherever you can. And you collaborate, right? So you're referring to your internal partnerships and people. So they're not just relying on Carly, they're relying on an agency and a hub of agencies all working together. And that you do what you're going to say you're going to do, right? So that you're trustworthy and you always have boundaries, especially with this population. And that you empower people to make decisions that are best for them, and you support their decisions and you let them lead in their decisions. So yeah, trauma-informed practice 101. Excellent. I just wanted to share 3 resources before we get into questions. And sorry, I know I covered so much in such a short period of time. But there's the most amazing resource. It's called, that's the website, livingincommunity.ca. They have a toolkit for working with young people who are involved in the sex trade. They have a tool for parents. They have a tool for schools. They have a tool for residences and businesses to understand sexual exploitation, to understand sex work, to understand the difference between the two. And they're incredible, incredible resources to check out. So please take a look when you have a moment. Next one. And then this is a really fun, amazing resource for young people. So we created a game called Likely Story, and it's a web-based game. So you would simply just go to likelystory.game, and you need 3 people to play. And it's a game where they give you, or we give you, scenarios that young people will inevitably be in their lives. And they're all related to healthy relationships and boundaries and consent. And they're the antidote to human trafficking, but like in a way that it's like feeding kids vegetables in a muffin, right? You don't know that you're learning while you're learning. And it feels really fun to play. And so I totally recommend doing this. So it's scenarios that young people will inevitably be in, and they would plan how they would respond to those scenarios in advance of actually being in them, and having fun along the way. So please check out that game and spread the word about Likely Story. Yeah, you're going to get a copy of this whole PowerPoint, and all of the links of every resource I'm sending are right at the top. And then lastly, for those of you that don't know, we have a Canadian human trafficking hotline. And I suggest anyone who, you should share this widely with any clients that you support. It's confidential, it's multilingual, it's 24 hours a day, and they're amazing. So check out their website, but also please, put posters on their website. There are posters to download from your agent for your agency. Put these up everywhere so that survivors know, even if your agency isn't open, maybe you're only open during 9 to 5 business hours, that if they are in crisis, or if they need help, or if they just simply want to talk to someone, that we're very fortunate to have this crisis line in Canada, 24 hours. And they have incredible resources in terms of statistics, who calls them and the nature of the calls. And they just came out with a new report. So definitely check it out. Thank you. I know I did that like on, sped through it. So apologies for the speed of how much we squeezed into an hour, but I hope we can cover more in some of your questions.
That was great, thank you. And my apologies for the technical difficulties. I'll make sure you get all the videos that we missed. So let's see if anyone has any questions. You can either pop them in the chat or put them in the Q&A bar at the bottom. So far, there's the question regarding trans or gender non-conforming folks. So I think you answered that one.
And I haven't seen that movie. For the person who put that in the chat, I haven't seen it, but I'll definitely check it out. Are there any questions?
I have a question. So if someone was, say they are ready to leave their situation and they want to like report make, like, what's the next steps for that person after they feel safe and comfortable to do so?
Yeah, so I mean, and this might sound like a dumb question. Do you have human trafficking specific police teams, units?
I think that
Probably in
there
some places and
is,
some not.
yeah, based on some email signatures I've seen, yes, we do.
That's good. That's really amazing. I mean, I would say anything you can to not get like to skip the step of having to tell their story. Obviously, as you know, we want to minimize the amount of times they have to share their story. So if you can build a relationship with your human trafficking units of your police force, if that's what you mean, a police report. Is that
Yeah,
what you
for
mean,
sure.
Jasmine?
Yeah.
Yeah. Yeah, so then I would say have really collaborative relationships with police units who specialize in human trafficking, or reach out to a contact you have at your service. And if there isn't a specific human trafficking unit, try to build a relationship with someone, or a bridge relationship with someone who can sensitively support survivors, and you know, where appropriate, assist in you know, helping them provide a statement. But you know, sometimes they're not allowed to physically be in the room, you know, all of those things. Like we have a trauma dog, for example, and so when someone gives a statement, we try to book Dandy to be there with them, even though we can't physically be in the room. And yet, you know, doing it in a comfortable space, right? Like anything you can to be trauma informed. So for example, we often ask to give statements in our soft room, right, instead of it being in the police, you know, at a police station. So, you know, whatever you can to make a survivor feel comfortable, and also not to pressure a survivor to give a statement. Like that's something, I mean, like it's literally like a 2-year commitment, right? And so they have to really understand what it is they're signing up for. And you know, I will tell you, not to discourage people from making police reports. By all means, we need people to report so we can catch these people. But you know, our survivors tell us they have the trauma of being trafficked, and they have the trauma of going through the criminal justice system. It's incredibly horrific to have to share your story, you know, again and again. And so anything you can to mitigate and to make people feel more comfortable, you do. I hope
Awesome.
that
Thank
answers your
you.
question.
Um, Someone asked, have you seen an increase in the use of technology in human trafficking, or is it still more between people who know each other in real life?
Yeah, there was definitely an increase in online through COVID, and that's continued since. I mean, just in terms of like young people using technology, I don't think it's stopping, even though, you know, you can live your life freely again. But they're still using relational tactics. So, and they're also, still not often a stranger. So it might be someone like that you have common people with on Instagram, or you have friends in common with on Snapchat. So you feel like a little bit safer with that person because you feel like, oh, my cousin's friends with them. Oh, my cousin goes to the same school as them. Oh, my friend Sarah also follows them, right? So they're using the relational tactics online that they would in real life. And so again, it could be a stranger, but what we're more often seeing still online is these commonalities. So you lessen your boundary slightly because you have some sort of person in common, or they went to the same high school as you, or, you know, but mostly it's friends in common. It's not usually a cold, you know, we do hear about cold, hey, you all about the money for people they know were already trafficked that they want to traffic next. But that wasn't the first time that person was trafficked. Does that make sense?
Yes, for sure. There's another question. Do you know if there are different rates of sex trafficking in countries that have legalized, not just decriminalized sex work?
Yeah, I mean, I can give you my personal my personal opinion from reading the literature, but it is my personal opinion. I believe in total decriminalization. When you legalize something, then there is, of course, government's ability to legislate it. So, for example, in Amsterdam, a lot of sex workers complain that like they have to get mandatory testing for STIs, but like the Johns don't. And so there's continued discrimination of women and sex workers. the most impressive research I've read is in places like New Zealand, where it's completely decriminalized. And we have like a partially decriminalized model in Canada where selling sex is legal, but buying sex is illegal. But I believe that continues to push a market further underground. If the people buying it don't want to get caught, then they're asking people who are selling it to take risk in order to keep it a secret. And so that really scares me. And so I believe my interpretation of the literature is that a fully decriminalized model is the safest model for sex workers and human trafficking survivors.
Awesome. There's another question. I'm not entirely sure, but someone's asking that someone goes with police when speaking to victims. They're asking how important this is, and you may or may not know this, provincial support. How does provincial funding support this type of position? You
Sure.
did touch on
So,
that a little, but.
yeah, so we piloted that and evaluated it. So if anyone wants a copy of that model in terms of the evaluation of social worker partnership with police or even trafficking, I'm happy to share it. I mean, to me, the answer is like, it's a no doubt, why not? It's a bonus if the person is a survivor, but I don't think that that is the be all and end all. Like, I mean, amazing if the person is a survivor, but also well enough to engage in, you know, therapeutic work. I think that it's really important though, that the police go with a social worker, and that, you know, that services are provided without the pressure of feeling like someone needs to report. But I should also say that human trafficking units of police have come so far in being trauma informed. And so, yeah, I would say it's a best practice. If you could send a social worker, bonus if it's a survivor social worker, to support other survivors in getting support. I would say the results of the evaluation are very clear that it helped people. I can tell you, I used to be the executive director of a different agency before where I am now. We evaluated this, and police reports of human trafficking went up 30% since embedding us as social workers into the police unit. Even though we were separated, we were embedded, co-located. And that's because of, I believe, because of the comfort that the social workers gave, and because the social worker police relationship was so strong, the warm transfer and the collaboration made survivors feel more comfortable reporting. And so happy to share evidence of, you know, evaluations of programs like this for anybody to see.
I don't see any other questions. We'll give it a few more seconds, and if not, anyone going once, going twice? All right. Well, thank you so much, Carly, for sharing your knowledge with us today. When you close this window, you'll be directed to a link where you can complete a short survey evaluation of this session. Completing these evaluations helps us create programming and resources that support your work. We really appreciate you taking the time to fill them out. Thank you all for joining us, and I hope you have a wonderful day.